Esophageal trauma and perforations. Esophageal trauma or perforations are injuries to the esophagus caused by external or internal insult. Pathophysiology and etiology. External stab or bullet wounds, crush injuries, blunt trauma. Internal swallowed foreign objects, coins, pins, bones, dental appliances, caustic poisons. Spontaneous or post-emetic rupture, usually in the presence of underlying esophageal disease, that is reflux hiatal hernia. Mallory-Weiss syndrome, Mallory, Mallory-Weiss, Weiss, Mallory-Weiss syndrome, non-penetrating mucosal tear at the gastroesophageal junction caused by an increase in transabdominal pressure from lifting, vomiting, or retching. A predisposing condition is alcoholism. Clinical manifestations: pain at the site of injury or impaction, aggravated by swallowing. Chest pain may be severe. Dysphagia or odynophagia, persistent foreign object sensation, subcutaneous emphysema and crepitus of face, neck or upper thorax, noted in cervical, thoracic and esophageal perforations. Temperature elevation occurring within 24 hours of trauma, blood-stained saliva or excessive salivation, hematemesis, previous history of vomiting or retching, Mallory-Weiss syndrome. Last one, respiratory difficulty if there is pressure on the tracheobronchial tree from injury or edema. Diagnostic evaluations: history of recent esophageal trauma, chest X-ray to look for foreign body, esophagogram to outline trauma, endoscopy to directly visualize trauma. Management: first one, maintenance of adequate respiratory functioning, may require oxygen support or endotracheal intubation to ensure an open airway in the presence of edema or of the neck. Second, replacement of IV fluids, may need blood transfusion, bleeding may stop spontaneously, if not endoscopic hemostatic therapy or surgery is indicated. Third, restoration of the continuity of the esophagus by removing the cause. Fourth, for external wound injury, emergency first aid, wound care and surgical repair may be indicated. Fifth one, for swallowed foreign bodies, barium swallowed determines location of foreign body, usually removed through endoscopy. Some patients with a history of food impaction may be treated with a spasmolytic such as IV glucagon. Sixth one, for chemical ingestion, if lye or other caustic or organic solvent was swallowed, do not try to induce vomiting. Treat with IV fluids and analgesics. A gastrostomy may be performed either as a temporary or a permanent means of feeding the patient. Resulting strictures may be relieved by dilating the narrow esophagus. Reconstructive surgery may be necessary to create a new passageway of food between pharynx and stomach. Complications: airway occlusion, shock, perforation with mediastinitis or pleural effusion, stricture formation, and abscess or fistula formation. Nursing assessment must include vital signs, respiratory status, intake output, bleeding and ability to swallow, choking or gagging. Monitor the patient for hypovolemic shock. Nursing interventions must include maintaining fluid volume, maintaining neutral status, maintaining respiratory function, reducing pain, and health education and health maintenance. Thank you.